Committee on Health and Human Services Finance will come to order. We do have a quorum. Representative Heinzman moves approval of the minutes from March 27th. Any additions or corrections? Hearing none, all those in favor say aye for adoption. Aye. Opposed, no. The minutes are adopted. First up, we have Representative Swedzinski with House File 3856. Welcome to the committee, Representative Swedzinski. I will move that House File 3856 be re-referred to the Committee on Ways and Means. I show no amendments. We have the bill before us. Representative Swedzinski to 3856.
Thank you, Mr. Chair. Members, House File 3856 simply provides that a single site fee of $275 instead of a $275 per boring applies to all exploratory borings marked up on boring maps submitted to the Commissioner of Health. So what happened is, I think it was a year ago or so, some policy was moved forward that simply stated that it's $275. Didn't state that because these maps get laid out, it's essentially a plan. It's called a boring plan. There might be 10, 5, 6, 8 of these boreholes within each plan. We're just saying for each plan, we keep the fee, but just limit it to per plan rather than per boring. So that's what the bill does, and I appreciate your support.
All right, Representative Swedzinski, there are no testifiers.
I have folks here for questions, but I know, Mr. Chair, you have a full agenda today, so we thought we would spare you as much as possible.
Appreciate that, Representative Swedzinski. And are there any member questions? Representative Murphy.
Well, thank you, Representative Dean. I thank you for bringing the bill. I am curious to know what the budget impact of this change would be.
Representative Swedzinski.
Mr. Chair, members, so currently, it's estimated at, we don't have a prime fiscal note, but we are at like 20,000, I believe. Well, potentially per business that was affected. So we can, we do not have an exact total, but as far as I'm concerned.
Representative Swedzinski, I believe that we do have a fiscal note that was just off the presses, and that's going to be handed out right now.
Representative Murphy, that's my answer right there.
$40,000 in 19 to 21.
$40,000 cost to the state? Sorry.
Yeah. That was a good time.
Representative Loeffler.
Well, thank you, Mr. Chair. Mr. Swedzinski, unfortunately, my area has a lot of industrial past, and we know things about losing control of the plume or trying to discover where the plume is, and now we've had TCE vapors rising from previously clean sites, infiltrating houses and businesses. And I'm wondering if there shouldn't still be some adjustment for complexity, so that if you have a really complicated investigation where you're going to have lots of potential borings just to try and figure out where has the plume moved to or whatever, should there be some provision for, it's 275 up to so many, but that if you have a really complicated, geologically difficult situation, that they could recover more of their costs.
Representative Swedzinski.
Thank you, Mr. Chair. Representative, this simply affects like boring for when it comes to mining, for taking out cores, not necessarily environmental. So environmental wells, those same things I do believe still occur. So it's not necessary for a monitoring bore, it's to actually see what's there as far as a solid rock.
Well, Mr. Chair,
Representative Loeffler.
one of the things we've learned from public health, though, is that every time you create a hole, you potentially create a place for things to seep into the groundwater or the aquifer. And so it still seems like even if the purpose is mining, you don't want to create an incentive to do lots and lots more than are necessary, because it does create some environmental risk. And has the health department and the PCA been working with you on this?
Representative Swedzinski.
Yes, Mr. Chair. Yes, everyone signed off on this provision. So we follow all health codes. So when those bores are complete, when it's been moved through, they're all sealed according to state policy. So.
All right, thank you.
All right. Further questions? Representative Halverson.
Thank you, Mr. Chair, and Representative Swedzinski. I think that it just needs to be said that people think what we do up here is sometimes boring, but even boring isn't boring, so thank you very much.
Needs to be said?
Now it's out there.
No.
All right. Further questions? All right. No further questions. Is there anyone from the public who'd like to testify on this bill? All right. Seeing none, final word, Representative Swedzinski.
Thank you, members, and Representative Halverson. I think you stole Representative Torkelson's thunder with that one.
All right. I will
I'd appreciate your
motion
support.
that House File 3856 be re-referred to the Committee on Ways and Means. All those in favor, please say aye. Aye. Those opposed, no. Motion prevails. House File 3856 is re-referred. Thank you, Representative Swedzinski. Next up, we will have Representative Scott. Representative Scott, I will move House File 3406. Laid over. All right. This bill will be laid over. Representative Scott, House File 3406 is before us. I see no amendments to your bill.
Thank you.
Welcome to the committee.
Thank you, Mr. Chair. Thanks for having me. This bill does three things, and it's a technical bill from the department. And the first thing that it does, this is all related to child support. The first line on 1.18 says that you cannot impute the income of people that are incarcerated. And that, by striking that line, that will put us in conformity to the federal law that says that we cannot impute that income. And the second portion on 1.19 through 1.23 is in regard to no imputation for SSI or GA income recipients. If they get income from an outside source other than that, other than any source of public funds, then that income can be imputed and figured in. And then finally, on page 2.17 through 2.21, that language is being stricken. The child custody working group that we had a few years ago wanted to be able to report to the credit agencies if someone fulfilled their child support arrearage, and we found out that the credit reporting agencies can't take on that information, and so it's inoperable, and so we're striking that language from law. And that's the bill. And there, Mr. Chair, there is a fiscal note of $23,000. It's one-time money in 2019, and that is for the IT adjustments that will have to be made to the child support system called PRISM.
Thank you, Representative Scott. The fiscal note should be in members' packets to look at the $23,000 cost. Member questions? All right, seeing none, does anyone in the audience want to testify on 3406? Seeing none, final word, Representative Scott.
Would appreciate your support.
Thank you, Representative Scott. With that, we will not be sending the bill on. We will be laying the bill over. With that, House File 3406 is laid over. Thank you, Representative Scott.
Thank you, Chair Dean.
Representative Torkelson. Representative Torkelson brings House File 3824, and I will move that House File 3824 be re-referred to the Committee on Ways and Means. We have the bill before us. Welcome to the committee, Representative Torkelson. I see that you have an A2 amendment. I will move the A2 amendment, Representative Torkelson, to the A2 or the underlying bill, however you'd like to describe it.
Well, thank you, Mr. Chair. I would like to describe this as a boring bill, but someone who apparently wants no transportation spending in their district is stolen my joke. What's with your committee, Mr. Chair? Have you
Mr.
control?
Chair, I beg the chair's forgiveness.
I'm sure he will.
Thanks for that. The amendment, Mr. Chair, adds some language that has also been agreed to. There's peace in the valley on both the amendment and the underlying bill, and I would be happy to delve further into it if necessary.
All right, if there's no questions, let's go ahead and adopt the A2 amendment. All those in favor of adoption of the A2 amendment, please say aye. Aye. Those opposed, no. The A2 amendment is adopted. House File 3824 as amended. Representative Torkelson.
There is a fiscal note. I don't know if it's in your packets. The fiscal impact is very small, about $11,000 a year.
Yeah, I believe it is. 11 a year in
Or
22.
over 2 years. Maybe perhaps the fiscal person should talk about the fiscal note.
Okay. All right. Mr. Berg, can you describe the amendment? There's two amendments. Maybe you can help us out with the $18,000.
Mr. Chair and members, Representative Torkelson is right that the fiscal note for the underlying bill is 11. There is a second fiscal note in your packet that's the 2A, which is the amendment you just put on. That changes it to 18,000 in the first year and 11 in the tail. So the correct fiscal note to look at now that the amendment on is the 2A version.
All right, thank you. Member questions? All right, I don't know if I asked, did anyone from the audience want to testify on this bill? All right, seeing none, final word, Representative Torkelson.
Thank you for hearing the bill, Mr. Chair.
Thank you. With that, I will renew my motion that House File 3824, as amended, be re-referred to the Committee on Ways and Means. All those in favor, please say aye. Those opposed, no. 3824, as amended, is re-referred to the Committee on Ways and Means. Thank you, Representative Torkelson. All right, Representative Franson
Okay.
moves House File 822. Representative Franson moves that House File 822 be re-referred to the General Register.
Good afternoon. And, all right, thank you, members. Thank you, Mr. Chair. So House File 822 is the athletic trainers bill, one that we have heard for numerous years. There is no fiscal impact to the state of Minnesota under this bill, and the athletic trainers remain under the Minnesota Board of Medical Practice, and no new regulatory boards will be required. The reason why this bill is here is that there are some fees that are being struck that are no longer needed, and so I will allow those to testify on this part of the bill.
All right, thank you, Representative Franson. Welcome to the committee. Please introduce yourself for the record and proceed in whichever order you would like.
Mr. Chair, my name is Amy Hamilton. I am a registered athletic trainer in Minnesota and a co-chair of the Minnesota Athletic Trainers Association Governmental Affairs Committee. Thank you, Mr. Chair and committee, for hearing our bill and allowing me to testify this afternoon. As many of you know, House File 822 is a bill that would transition athletic trainers in Minnesota from registration to licensure. There are currently over 1,000 registered athletic trainers in Minnesota. We are healthcare professionals who must pass a national certification exam and maintain our competence through continuing education requirements. We currently must have either a bachelor's or master's degree at minimum from an accredited program to become an athletic trainer. Athletic trainers are seeking transition from registration to licensure, as we believe this will ensure better protection of the public. By becoming a licensed healthcare professional in Minnesota, we would be subject to mandatory criminal background checks as part of the credentialing process. Licensure also aligns athletic trainers in Minnesota with the majority of the nation. Currently, 49 states regulate athletic trainers, and 43 of those are at the licensure level. To further protect the public, the proposed bill also seeks to repeal the temporary registration statutes that currently allow an individual who has not successfully completed the national certification exam to practice athletic training in Minnesota for up to 120 days. Additional changes proposed have been made in discussion with the Board of Medical Practice as housekeeping measures or technical changes and include things such as repealing the temporary permit statute. The Board of Medical Practice discontinued this option for credentialing back in December of 2016. The proposed changes streamline the application process for a credential into one subdivision rather than having a separate section for reciprocity candidates. The bill increases continuing education requirements in Minnesota to mirror the maintenance of competence expectation by the national certifying body. This bill would not alter the scope of practice for the athletic trainer, and it does not reduce the physician supervision of the athletic trainer. We would remain under the Minnesota Board of Medical Practice, and the main reason I believe we're here today is to discuss that there's no fiscal implication to this bill. The bill does not affect the regulatory cost to the state. The Athletic Trainers Advisory Council of the Board of Medical Practice already exists, and the initial application fee and the renewal fee that are currently in statute would remain the same. The fees that are struck in Section 21 are for the temporary registration and the temporary permit that I've already discussed are being removed from the bill. So those would be the only fee changes to the bill, and those are for the temporary credentials that would no longer exist and therefore no longer need a fee associated with them. We do have the support of the Board of Medical Practice and several other healthcare professions who have taken interest in our practice and bills in the past for our current language and the proposed changes. I'm happy to answer any questions the committee may have. Thank you.
Thank you, Ms. Hamilton. Two member questions. Representative Liebling.
Thank you, Mr. Chair. And so I apologize if I've asked this question before, but I guess I still don't really know the answer. Is there going to be any change in billing of Medicaid or Minnesota Care? Maybe you said no to this in a previous committee, but I just want to clarify that because we have the fiscal note in front of us. It shows 0, and there's nothing here about any additional billing for public health care programs. So could you just state that on the record?
Mr. Chair?
Ms. Hamilton.
It is certainly not the direct intent of this bill to contribute to healthcare payments, to the healthcare payment system. This proposed bill is only intended to address the regulation for the state's ATs. And strengthen the public protection. This proposed bill does nothing to change the practice that currently exists in Minnesota, which is that typically athletic trainers are not covered under health insurance plans. Any athletic trainer that would seek to be covered under a health insurance plan would need to negotiate that coverage on their own or through the healthcare organization that employs them. So this bill does nothing to change that in any way.
Representative Liebling.
Well, thank you. And I understood that this was not coming here explicitly to change billing, but that's not really the question. You know, often when professions are licensed, it opens the door for them to bill public programs and private insurance, I suppose, too. But my concern here is with the public programs. And so even though it's not intended to change that, the question is really, does it have the potential to change that now? Maybe you could just answer the question of whether athletic trainers right now, do they bill public programs directly at all? And after this bill becomes law, if this bill becomes law, will they then be able to bill Medicaid directly?
Ms. Hamilton.
No, athletic trainers do not bill public currently. There are 7 states where athletic trainers are getting reimbursement from private insurers, but that is only 7 states, and Minnesota is not one of them. And there is no national billing of the public payers.
Representative Liebling.
Thank you, Mr. Chair. Well, I'm really not getting an answer, a clear answer here. And, you know, that is, you know, I think there's, in general, I'm kind of a skeptic. Everybody knows that, I think, that I'm a skeptic of increasing licensure, which I think our statutes require us to be skeptics. And, you know, that there needs to be a real public purpose to increasing licensure. And in this bill, I think that the proponents have articulated some reasons to go to licensure. But oftentimes, the real underlying reason to go to licensure is for billing. And I have not received a clear no that that's not going to happen. And so my speculation is that in sometime in the not-too-distant future, that athletic trainers will be billing Medicaid and Minnesota Care for their services. So, if that's not something that the athletic trainers are looking for, I mean, I think that would be good to know that, but I'm going to assume that that's, in fact, kind of in the background here, because I'm not getting a clear no.
All right, other questions or comments from members? All right, seeing none, is there anyone in the audience who'd like to testify on this bill? Ms. Martinez, would you like to offer any testimony since you're here?
Mr. Chair, members, I'm Ruth Martinez, the Executive Director of the Board of Medical Practice. Just to confirm that we, as a board, did not find a fiscal impact, as this is just a transition from registration to licensure with no new fees. Thank you.
Thank you, Ms. Martinez. All right, with that, final word, Representative Franson.
Well, members, it's very exciting to get this bill this far this year without the conflict that has been brought to us in previous years. It has been a joy to carry this bill for the last 3 terms. I want to thank my wonderful constituent, Michael Doyle, in the crowd for coming on down today. He's been working with me for 6 years now on this issue, so that's it.
All right, thank you, Representative Franson. With that, Representative Franson renews her motion that House File 22 is re-referred to the General Register. All those in favor, please say aye. Aye. Those opposed, no. 822 is re-referred to the General Register. Thank you, Representative Franson. Next up, we have House File 1122, Representative Albright. Representative Albright moves House File 1122 be re-referred to the Committee on Ways and Means. There is no amendment. There is a fiscal note which is being distributed now. Representative Albright to House File 1122.
Mr. Chair and members, House File 1122 establishes licensure requirements for speech-language pathology assistants to be administered by the Commission of Health. Under a licensure system, only persons who meet predetermined qualifications and obtain a license are able to use protected titles in practice as a speech-language pathology assistant, and persons without those qualifications are prohibited from using protected titles and practicing as a speech-language pathology assistant. This bill establishes requirements for a full licensure and a restricted licensure. The licensing requirements would become effective January 1st of 2019. Mr. Chair, in the members' packets, there is a fiscal note. I would ask if Mr. Berg could explain that for the members.
Mr. Berg.
Mr. Chairman, members, there is, as Representative Albright mentioned, a fiscal note on this. It shows on the cover page a net cost to the state government special revenue fund of $7,000 in 19, of $22,000 in 20, and a savings in fiscal 21 of $20,000. If you want more detail on page 3, that is a mix of additional revenue coming in and expenditures. I will note on this bill that there will need to be an author's amendment in the Ways and Means Committee just to appropriate those funds, but the state government special revenue account is got enough money to cover this, so.
Thank you.
Representative Albright.
Thank you, Mr. Chair, members. Thank you, Mr. Berg. I do have a testifier, Mr. Chair, that would like to give testimony and flesh out the circumstances and the reasonableness of this bill.
Welcome to the committee. Please introduce yourself for the record and proceed.
Good afternoon, Chair Dean. My name is Nancy Toole, and I am a licensed speech-language pathologist in the state of Minnesota. I am a member of the Minnesota Speech-Language Hearing Association, and I'm also a member of the American Speech and Hearing Association, which is our national group. I have worked in this field for the past 34 years, and I currently teach at Alexandria Technical and Community College, plus I am a speech-language pathologist at Long Prairie School, and I've been there for the past 20 years. I ask you to support this bill because here are a few things I think you should know. There's a severe shortage of speech-language pathologists in the United States and in the state of Minnesota. Like I said, I've been a speech-language pathologist for 34 years, and there has been a shortage that long. Our speech-language pathologists, or sometimes we're referred to as SLPs, in the state of Minnesota need skilled, qualified help that are able to help them, and this comes in the form of an SLPA who is trained in a specific program for speech-language pathology assistants. Right now, speech-language pathology assistants in our state are unregulated. We, as speech-language pathologists, and in this case, SLPAs, are working with people that have communication disorders. So keep in mind that this is not just the regular learning of language and speech. These are people who have a disordered language or a disordered speech, among other things. Some of the communication disorders that we cover, just to kind of help you understand the umbrella that communication disorders covers, are sounds in error, stuttering, language disorders that include vocabulary and memory problems, plus voice disorders, autism, auditory processing, brain trauma, apraxia, aphasia, dysarthria, and there are many more. These are complex disorders, and they require special training in order to treat them. We are seeking licensure for the SLPAs. Currently, in the state of Minnesota, occupational therapy assistants and speech or physical therapy assistants have a place in Minnesota, and they are licensed in our state. OTAs and PTAs can currently bill for medical assistance. If this passes, and I hope it does, we would also seek that because it would also be another source of revenue for our schools who would be employing SLPAs. I feel that Minnesota has always been ahead of the curve in education, and other states look to us as leaders. And as we move ahead with this bill, we want to be ahead of the curve and ahead of the whole process. The American Speech Language Hearing Association is supporting the use of SLPAs, and in fact, they're moving towards having states license SLPAs. Thanks for your time, and I appreciate your support. Does anyone have any questions?
Questions for the testifier? Seeing none. Does anyone in the audience want to testify on House File 1122? Seeing none, final word, Representative Albright.
Thank you, Mr. Chair, for hearing this bill.
All right, with that, Representative Albright renews his motion that House File 1122 be re-referred to the Committee on Ways and Means. All those in favor, please say aye. Those opposed, no. House File 1122 is re-referred to the Committee on Ways and Means. Thank you, Representative Albright and the testifiers. Next up, we have... Okay. Next up, Representative Albright moves House File 4249 to the General Register. Representative Albright, House File 4249 is before us, and I see that there is a DE1 amendment.
There is, Mr. Chair, and I'd like to explain the rationale for the DE.
Representative Albright.
Thank you. In the conflicts of various jackets moving between both that other chamber and the House, it became apparent to us that we did not have the proper companion, and so the H4249 DE1 is the proper matchup with the companion that is moving in that other chamber. And I would appreciate if we could just put this one, for the sake of all the constituents, in the same form as what is traveling over there, so that we can move it forward.
All right. Questions on the DE1 amendment for Representative Albright? Seeing no questions, all those in favor of adoption of the DE1 amendment, please say aye.
Aye.
Opposed, no. DE1 amendment is adopted. House File 4249 as amended. Representative Albright, to your bill.
Thank you, Mr. Chair. Mr. Chair, there is also in the members' packets a fiscal note I don't know that I am going to need to phone a friend on this one. There is no cost from a fiscal perspective.
All right.
Mr. Chair.
Representative Albright.
Thank you, Mr. Chair. Just to summarize the bill itself, this bill as amended now would change the definition of child care staff person for the purposes of the Department of Human Services background studies, and exempt persons ages 13 to 17 residing in a licensed family child care home or legal non-licensed child care program from the requirement to submit fingerprints and photographs for a background study. The amended bill would not modify the existing disqualifications specific to a child care staff person or persons over the age of 13 residing in a licensed family child care home or legal non-licensed child care program. We have worked tirelessly with the constituencies, and I'm proud to carry this bill forward. I urge your support.
All right, Representative Albright. Questions for Representative Albright? Oh, Representative Considine.
Not a question. We met with daycare providers back in October in Mankato, and I've just found this terribly troubling that their children were required to submit fingerprints, and thank you for carrying this.
Further discussion? All right, seeing no further discussion, Representative Albright renews his motion to refer House File 4249 to the General Register. All those in favor?
Aye. As amended.
As amended. Those opposed? House File 4249 as amended is re-referred to the General Register. Thank you, Representative Albright.
Thank you, Mr. Chair and members.
All right, next up, we have House File 3795. Representative Pearson moves House File 3795 to the Committee on Transportation Finance. 3795 is before us. Representative Pearson, and I understand there is an A3 amendment.
That's correct, Mr. Chair. I'd
Would like to move the A3 amendment?
You bet.
Representative Pearson moves the A3 amendment to the A3 amendment. Representative Pearson.
There was just a little bit of confusion coming out of the previous committee on some language, and we've got that corrected with the A3.
All right. Questions regarding the A3 amendment? Members, I think, have the A3. All right. All those in favor of adoption of the A3 amendment, please say aye.
Aye.
Those opposed, no. The A3 amendment is adopted. House File 3795 as amended. Representative Pearson.
The bill basically allows the disclosure of individuals' name, date of birth, address, and program eligibility status between the Department of Human Services and Metropolitan Council in order to coordinate special transportation services. So main focus is, again, that it's just making sure folks are eligible, and this allows Metro Mobility and the Met Council to have reimbursement on federal programs, is my understanding. So we'll save a significant amount of money, and we'll help out the taxpayers in that area. There's also a component of this that adds Metro Mobility services to an area that is currently paying the fees, but they are not given access to it. And so in honor of our punny morning so far, it's basically taxation without mobilization, and we want to correct that.
All right. Questions for Representative Pearson on House File 3790?
It's no worse than boring, come on.
All right. Seeing none, does anyone in the audience want to testify on House File 3795? Seeing none, Representative Pearson renews his motion that House File 3795 as amended be re-referred to the Committee on Transportation Finance. All those in favor, please say aye. Aye. Opposed, no. Representative, House File 3795 as amended is re-referred. Next up, we have Representative Quam.
I like it. It wasn't my material, it's okay. It's not my bill.
Welcome to the committee, Representative Quam. I will move that House File 3780 be laid over. We have no amendments on the bill. We do have a fiscal note in members' packets. Representative Quam, to your bill.
Thank you, Mr. Chair and members. This bill came about from meetings, public meetings with daycare providers and the agencies. And all the articles were requested. We did have in previous committees amendments that came from the department, and then a small clarifying amendment that came from the daycare providers. And it is just to improve communication, disclosure, and make it more friendly to all parties. And then the last portion is to have the director look at all the different myriad of background studies, try to get some clarity, uniformity, and consistency, so that, one example is you may have somebody that's working to sub in several different programs across 5 counties. And that actually, I've talked to people that are doing that, and that way you don't have a fee in each of the 5 counties. You basically, once a person does a background study and they pass, they would be able to, the county would be able to check and be told, yes, that person has a past background study and it's good through such and such a date. And that way you would get rid of some duplicative activity and decrease the amount of fees that the providers would be having. And I'm open to questions on any specifics.
Thank you, Representative Quam. Is there any member questions on Representative Quam's bill? All right, seeing no member questions, does anyone in the audience want to testify on House File 2780? Seeing none, final word, Representative Quam.
Just that I noticed you are having a youth movement in your, staffing there, Mr. Chair, and I like the idea.
She's doing a good job. All right, thank you. With that, Representative Quam, I will renew my motion, House File 2780 be laid over. Thank you for coming back to the committee. Good to see you, Representative Quam. All right, I have a couple bills.
Did you do Tork's bill already?
All right, I'll move House File 3024 be re-referred to the General Register. Chair Dean, you have a A1 amendment. Shall I move that for you? Or would you prefer to do it yourself?
Makes no difference to me. It's a A1 amendment.
Chair Dean moves the A1 amendment. To your amendment, Chair Dean.
This A2 amendment, this is the gag bill that most of us heard in the policy that says that pharmacists can let you know if there's a cheaper alternative to the medicine that you're purchasing. And the A2 amendment, or the A1 amendment, is a definition of allowable cost This is from language from another bill that I believe is Representative Peterson's bill that just describes it a little bit more. So with that, would like to put on the amendment.
Discussion to the amendment? Seeing none, all those in favor of adoption of the amendment, please signify by saying aye. Aye. All opposed, no. Amendment is adopted. Chair Dean, to your bill as amended.
Thank you, Mr. Chair and members. This is the gag rule that we have heard in a couple committees. And what this simply does is that currently, because of the relationship that pharmacists have with outside groups, sometimes prohibits them from letting customers know when they can get a cheaper medicine. And because of their agreements, this would say that they can't be prohibited by from saying to a customer, this would be a lot cheaper if you just bought it this way or purchased it with cash or whatnot. So that's what this does, and it allows a little bit more freedom for our pharmacists. So with that, it's a pretty simple explanation, simple bill.
And Representative Dean, do you have any testifiers to the bill?
I believe I do. I think there was some that signed up. Mr. Flanders signed up. There's one other one? No? Okay.
All right, seeing none, is there anyone in the audience other than what has been identified wishing to testify to the bill? Anyone in the audience? Seeing none, we'll close audience. Go to member questions for the author. Representative Considine.
Thank you, Mr. Chair. Are we talking about like generics, or are we talking about completely different drugs?
Representative Dean.
Mr. Chair and Representative Considine, from the testimony that we had from the pharmacists that testified, it would be exactly the same, that they could just purchase it in another way, that they could get it cheaper. For example, that their copay might be higher than a cash price at the same pharmacy, I believe was the testimony that was given in one instance, or that if you purchase it in another way that you can get it cheaper. So that's what just allows the consumer to have a little better deal.
Representative Considine.
No, thank you, Mr. Chair.
Representative Liebling.
Thanks, Mr. Chair. Not so much of a question, it's just a comment that I appreciate that Representative Dean is carrying this bill. And this is just a tiny little move forward for consumers who are just completely outmatched by the pharmacy benefit managers and the insurance companies and the way the pricing is done, and the consumer just has barely a fighting chance. And this just allows the pharmacist, should she or he be willing to do so, to give the consumer a little bit of help and information. And so I just think this is just kind of a no-brainer for all of us, and I appreciate that Representative Dean is carrying the bill, and I certainly hope we can get this enacted this year.
Any further questions? Final word.
Appreciate your support.
Thank you, Chair. I will renew my motion to re-refer House File 3024 as amended to the General Register. All those in favor, please signify by saying aye. Aye. All those opposed, no. Motion fails, and House File 3024 as amended is re-referred. All right, I'll move House File 4191 before the committee, and this one is being re-referred to the Ways and Means. To the bill, Chair.
Thank you, Mr. Chair and members. This is a technical bill. House File 4191 is a forecast adjustment that simply reflects the forecast number changes for the Human Services appropriations for 1819, and that's all it does.
There are no amendments, and so is there anyone in the audience who wishes to testify on the bill? Seeing none, we'll close that and move to member questions for the author. Representative Murphy.
Thank you, Mr. Chair. And Chair Dean, I'm just wondering if you can, I know it's simple, but can you share with me just a little bit about why and what the goal of this is?
Chair Dean.
Mr. Chair and Representative Murphy, this is just the Human Services appropriations changes, and I could have somebody from the department come down and talk through the specifics of the changes if that's possible.
Or Mr. Berg could also assist, I believe.
Or Mr. Berg, if you can fill in.
Mr. Chair?
Representative
Mr. Chair
Murphy.
and Chair Dean, I don't need to walk through it. I just wanted to understand the why.
Mr. Berg?
Mr. Chair, members, this is a standard business that we, and incidentally the K-12 committee, do every year to correct the appropriations that have already been put in law to the forecast. The numbers you see in front of you connected to the programs line up our appropriations with the February revenue forecast. And if you look at line 1.20, they create a net reduction in appropriations of about $290 million. A large portion of the bottom line number that appeared in the February revenue forecast is created by this bill. This is the governor's language. It has no controversy.
Representative Murphy. Any other questions for the author of the bill? Representative Liebling.
Thank you, Mr. Chair, and one would think that I would know this after all these years, but I don't. And if Mr. Berg would just one further piece of this. Could you just explain, if we didn't do this, what would be the consequence?
Mr. Berg.
Mr. Chair, Representative Liebling, in the short run, the budget surplus that we are all talking about to what to do with wouldn't exist until the end of this fiscal year. Ultimately, these numbers would cancel when the fiscal year closed, and then the books were closed on the fiscal year. These appropriations would go unspent and they would cancel, but that's the long way around, and it would take months of extra time to get to what the February forecast is saying. Here's where we are. So we're doing now what the forecast says. Now, there's a separate issue you'll see if you look in two places, or three places, there are numbers that are positive numbers. In those cases, the programs are going up and we're actually appropriating funds. This is a net savings of almost $300 million, but there's a slight increase in the Minnesota Care Program from the Healthcare Access Fund, an increase in Chemical Dependency Treatment Fund entitlement grants, and an increase in the technical activities, which is child support collections. If we were not to pass these, they would not have those appropriations for those programs and would not be able to treat those programs accordingly. So this is how we do a forecast.
Representative Liebling.
Thank you, Mr. Berg. I mean, I'm sure everybody else on the committee did understand it. It was just me, but I appreciate the explanation.
Final comments. Representative Dean.
Renew my motion.
With that, I will renew the motion that House File 4191 be re-referred to Ways and Means. All those in favor signify by saying aye. Aye. All opposed, no. Motion prevails, and House File 4191 is re-referred. Next up, Chair Dean, we have House File 3062. I'll move that before the committee. And this will be re-referred to the General Register. Representative Dean.
All right, House File 3062 is an opioid education bill that was brought to the legislature by Representative Lunen's constituents, students in his district, and that wanted to see what they could do about the opioid crisis in Minnesota, and looking at continuing education both in the high schools as well as in the post-secondary colleges in universities in Minnesota to try to bring education so that we can do something upstream in the opioid crisis to try to get kids before they try their first opioid or are prescribed. and really trying to get as far upstream as we can with this particular bill. One of the things that we changed along the way was to broaden the scope a little bit. One of the suggestions was that kids were actually accessing this earlier than we had kind of conceived when we started. So we broadened it out to junior high as well. Brought along community leaders as well in trying to figure out the best way to get funds delivered to our higher education and our secondary education in our schools in Minnesota to really get kids, to prevent them from going down this path. This is a very small step in that direction in the scope of our work on opioid bills this year. This is the furthest upstream. Really gets at education of our kids and is a small step in the right direction. With that, I'd be happy to answer member questions.
I see you have a testifier with you today. Welcome to the committee, Mr. Watrous. If you could introduce yourself for the committee and present your testimony.
Great. Mr. Chair, members of the committee, my name is Matt Watrous. I'm the Government Relations Director for Boys and Girls Clubs of America for the Midwest region. We had 8 clubs here today across the campus, and many of them met with you, and thank you for those meetings. I want to give a sketch of our clubs in the state of Minnesota. We serve 45,000 youth annually, of which 14,000 are teens. 67% of the youth that we serve are on free and reduced price lunch. We're a go-to solution that's affordable for parents at an average price of $20 a year for our services. We also service target populations, in particular the Native American community at Leech Lake, Red Lake, White Earth, and also Little Earth in Minneapolis. Boys and Girls Clubs of America is targeting opioid prevention is one of the main priorities that we have on our radar, and there's a few things that we're doing on that effect. We're trying to build resiliency skills with our young people. We're also offering targeted programs that specifically deal with substance abuse prevention. We're tracking the data of those programs, and I can report to you today that of the kids that we serve, 94% of them abstain from alcohol compared to 67% of them of the general population of teens. And on the subject of prescription drug use, 93% of 12th graders that we serve abstain, while 80% compared to the general population. So those are very big differences, and those quantify when you look at 4 million kids across the country that there's a lot of kids not using drugs as a direct result of our programs. I'll further note that those statistics are of all the kids that we serve across a variety of programs, not just the ones that participate in a drug prevention program. So the club is a protective factor in and of itself, in addition to the programs that we're running that targeted this. We're also engaged in a lot of other things. Locally, I can share an anecdote that the Hennepin County Sheriff Stanek is doing a training on opioid prevention with our staff next week. Those are the kinds of community-based prevention programs and things that we're trying to do in a wraparound capacity. Thank you for considering this bill with the limited resources that you have, in addition to hopefully the funding that will come from the federal government through the recent passage of the omnibus bill. Thank you for your time and your support. Any questions?
Questions for the testifier? Is there anyone else from the audience that would like to testify to the bill? Member questions. Representative Lunan.
Thank you, Mr. Chairman. I just want to make a comment. How this came out of my district is our high school has what's called an academy set up now, where to increase student engagement, they break them into areas of medicine, arts, mathematics, science, business, and the medical area brought in law enforcement and a couple of us legislators to ask about pertinent questions. The opioid one was one of them. And frankly, these kids got better grades than I did. And they challenged me, and I said, why don't you come over to St. Paul? And they did. And they sat down with me, and they sat down with staff, and we shortened up the conduit. These people that are on the front line that want to get something done, and I want to shout out for staff, particularly Ms. Iverson, for working with these kids to go back and try to get real data input. It's surprising to me, some of these things these kids told me about the opioid situation and how people who are fighting with addictions, how they constantly are reloading with new friends, so they've got a new house to go into, so they have a new bathroom they can use, so they have a new medicine cabinet they can open. You know, and getting all this data, open it all up to them, that these are things to watch for, and some of these symptoms. And there's patterns to all of this, and hopefully we can improve this terrible situation.
Representative Loeffler.
Well, thank you, Mr. Chair, and I appreciate the fact that we had a hearing earlier in this year in this committee on where we're at with fighting opioids and the resources that are available to it. And I recall from that hearing that the Department of Human Services has a current grant program that is part of the built-in curriculum on abuse prevention, addiction prevention, which I understood was in all schools. And is it your intent that this, because the way it says any federal grant funding that they could have access to would be diverted to this? Is it your intent that this substitute for that current program working with the schools?
Chair Dean.
Mr. Chair, Representative Loeffler, it is not. This simply in an attempt to be budget neutral, to make sure that it goes through, and also reflecting the fact that we do have federal appropriations that are being guided down to the states for opioid, to fight opioid addiction and to address it at all phases, that we can avail ourselves of that both in our K-12 schools as well as post-secondary. So that's the intent.
Representative Loeffler.
Well, thank you, Mr. Chair, and I hope that as this moves along, Chair Dean, that you will carefully review the language to make sure that those broad-based programs that reach all children don't get displaced by a competitive grant program. Not that other partners can't do good things as well, because this is a major issue, but it just feels like in your list of potential community partners, it goes as far as local chambers of commerce, and that we could end up with just a competitive grant program that really isn't research-focused and isn't, doesn't give us the same kind of results that some of the programs that we have already funded do. So I'm glad to hear that your intention is to add to rather than substitute. Thanks.
Representative Liebling.
Thanks, Mr. Chair. Representative Dean, I just was reading the bill and kind of looking for anything here that might indicate that there's a requirement that the programs that are going to be done are based on any evidence that they might be effective. I mean, we've been doing drug abuse education in different forms ever since, well, probably even before Nancy Reagan famously said, just say no. And I was under the impression that, for example, the program that's called DARE, which has been around for a long time, has been, that evidence has indicated that it hasn't been very effective. And so, I think this is great. I mean, the purpose is absolutely terrific, and we've absolutely got to do this. I just wonder, though, if there's anything in here that requires this money to go to proven programs as opposed to, let's just give people some education.
Representative Dean.
Thank you, Mr. Chair. Representative Liebling, I just refer you to the section 1 of the bill that just looks at grant awards. It gives authority to the commissioners for that, and I would hope that that in their review of the applications that they would carefully consider that. I would say that what we are currently doing is not working with regards to opioid education in particular. So, hopefully the commissioners will take that direction. But I don't know if we did say that we were looking at proven models. I don't know that there is any really right now, because what I've seen is pretty disheartening from what we have in Minnesota right now.
Thank you.
Final thoughts, Representative Dean.
I renew my motion.
Representative Dean renews his motion that House File 3062 be re-referred to the General Register. All those in favor say aye. Aye. All opposed, no. Motion prevails, and House File 3062 is re-referred. Members, we are in recess until the call of the chair.
One more.
I'm sorry. One more bill. I retract. Pull it back in. We're back in order.
You can call the meeting to order.
Call the meeting to order again. Restart the engine.
I'll move the minutes.
We have a quorum. Did we approve the minutes? Oh, good.
Mr. Chair, I will move that House File 3023 be re-referred to the General Register.
Yeah, I see you have an amendment.
That is true. What the amendment does, this is CME requirements for opioid training for our medical practitioners and prescribers. And what this does, after the policy committee, we got some feedback from members as well as from stakeholders. That this says that we're going to have a couple hours on opioid training in order to get your license renewed. And this is not just doctors, but it's other prescribers as well. One of the suggestions that we had was, let's hope that 20 years from now that this is not a problem, and that we don't want to do this, be this prescriptive in terms of what people have to study to get relicensed. So I'm the last person in the world that likes to do that, so I was very happy to take the suggestion from members and stakeholders that we sunset this, and so I put an expiration on 2023. And the reason for that is to try to get at everybody who's writing out prescriptions right now, so they get caught once, and that that if you're a prescriber, that if we put it out for the coming year, we wouldn't catch everybody. If we throw it out a couple of years, we'll catch everybody once. And that's the intent of the amendment, Mr. Chair.
Representative Dean, I'll move the A3 amendment. For discussion to the A3 amendment. Representative Loeffler.
Thank you, Mr. Chair, and Chair Dean, I'm not on the Reform Committee, so I didn't hear this before, but was there any consideration given to best practices in prescribing opioids and controlled substances and their alternatives? Because I was impressed by the study that was just released by our VA that showed for people with chronic health issues, more standard pain responses are more effective, actually, than opioids, and that that was considered some new science that hasn't been broadly dispensed. So I'm just thinking, you know, rather than only talk about opioids, it would be nice to talk about what the science says on good alternatives.
Representative Dean.
Mr. Chair, Representative Loeffler, we did discuss that a little bit in the policy committee. In fact, Representative Freiberg had 2 amendments that he brought forward and was interested in kind of pursuing options, and those kind of have been pushed from 2 groups that have been kind of moving that. I really wanted to limit the scope of the bill. I didn't want to talk about acupuncture, cannabis, or anything else. I really just wanted to look at dangers and didn't want to get the bill derailed within alternatives. So I just wanted to look at this. Within opioids, some of the testimony has been that that the prescription of an opioid is not, opioids are not opioids. It can be a range of choices within that, from Tylenol with codeine to Percocet to oxycodone. There's a range of prescriptions that are more or less addictive within that family of drugs that might be appropriate. And then within that, to look at the number of pills that are being prescribed, so that the thing that we always hear about, the anecdotes we hear about are, you know, the 60 pills that get sent home to somebody with a tooth extraction versus, you know, for an orthopedic surgery that you know what you're being sent home with. So looking at which medication is appropriate within that family of drugs, if the family of drugs is appropriate, and then within that, which is the appropriate prescription, and then within that, which is the right dose, and then within that, how many pills are going to be dispensed at a time. And that's really what I think a lot of the physicians, the dentists, and the prescribers are doing within their specialties. They are, whether you're a surgeon or a dentist or whether you're a family practitioner, those subspecialties are really working very hard at saying this kind of drug and this many pills for this long before you come back. So we're getting a lot of guidance from the professionals, but that's not getting out to all of the prescribers, and that's really what this bill is aimed at doing.
Representative Loeffler.
Well, thank you, Mr. Chair and Representative Dean. I appreciate that, and I know 2 hours isn't a whole lot of time for a potentially complex subject. At the same time, I was just impressed by some of the new, really valid science that says because of the marketing of this by the manufacturers, we have become over-reliant on it, and in part, it's because those prescribing don't know about other alternatives. And I would hope that we would continue to work with the profession to see how to best address that.
Representative Dean.
I agree.
Representative Halverson.
Thank you, Mr. Chair and Chair Dean. Curious about standards in Minnesota regarding who is allowed to pay for and provide training when it comes to continuing medical education. I think one of the reasons we're in this problem now is that a lot of supposed education was given about opioids being less harmless and not addictive by the pharmaceutical manufacturers themselves. And does Minnesota have standards that provide a line between pharmaceutical companies and continuing medical education?
Representative Dean.
Mr. Chair, Representative Halverson, I'm not aware of any legislation that we have within that for CMEs or how they get accredited within their governing boards. I think that that's within the specialties. I'd have to check and can check on that, and we'll get back to you with that information because I don't know the exact answer of how the specialties do their CMEs. But I will say that we have changed our laws in Minnesota, are among the strictest in the nation about education from the industry to physicians has changed a lot in the last even 5 to 10 years. And in our area, my area that I represent is very close to Wisconsin, so many physicians are registered in both states, and Wisconsin actually has this legislation in place. And so that's actually where I got the idea for this bill, and that it will catch certain people that maybe are my age or maybe older in the profession that maybe were around when the pharmaceutical industry had a different tune about the addictive quality of some of these medicines. And maybe that those are the folks that we really need to catch. So to the folks who probably are signing up for this education anyway and really want to get this information and need this information, we're gonna make them jump through an extra hoop, and I apologize for that, but we are going to catch some folks that probably need to hear this that maybe heard a different story 25 years ago. So that's what this is attempting to do.
Representative Halverson, I see Ms. Martinez over Chair Dean's right shoulder, and I'm just wondering maybe we could invite her up to make commentary on your question as well.
Thank you, I'd appreciate it.
Welcome to the committee.
Mr. Chair, members, thank you. I'm Ruth Martinez, the Executive Director of the Board of Medical Practice. I don't know if I can fully answer the question because each board does its own continuing education accrediting a little bit differently. We each have standards for accrediting continuing education, and I'm confident that those standards are well established. For the board, we don't actually do the approval process ourselves. We rely on the American Medical Association and accrediting organizations. So I don't know if that answers the question, but I do know that accrediting is certainly in place for all of the health licensing boards that have prescribers.
Representative Halverson.
Well, thank you, Mr. Chair. I think it's something that we should keep an eye on. I think that the public, with us putting this into statute, and I know Representative Dean, this isn't always your preferred way to dictate what we teach, but that this is a priority problem and we need to figure out a way to get information out there. But I also think that there's an expectation that we maintain a bright line, particularly when it comes to this issue, because I think that that line has been blurred over the years about who is educating our doctors, and are we using really peer-reviewed, science-based education when it comes to teaching about opioids and opioid prescribing.
Representative Liebling.
Mr. Chair and Representative Dean, I'm not sure if we've adopted the amendment, if we're still on the amendment, but I just wanted to ask you, I like the amendment. I think it's a good, kind of addresses some of the concern. I just wanted to know if with the amendment, is there peace in the valley on the bill or still some heartburn about it?
Representative Dean.
Mr. Chair, Representative Liebling, certainly there's some concerns about, from the prescribers that, anytime we put restrictions on what they have to do to get relicensed, I understand their concerns around that. And I share those concerns, in fact, about doing that. And obviously, we wouldn't be doing this if it was not kind of in a different crisis category by itself. One of the concerns that I had was from pain management subspecialists that they would have to do this. They're like, well, this is kind of what we do anyway. And my response was, well, that's probably what your CMEs look like anyway, so this probably would fit within that. That's been the only real specific complaint that I've heard voiced. Outside of general, we really don't like you guys messing with the thing, because if we did this all the time, then we would dictate the entirety of their education, which we don't want to do. And obviously, we wouldn't do this if we didn't have to, and we want to limit it as much as possible.
Representative Liebling, follow-up.
Yeah. Oh, thank you, Representative Dean. I think you and I are really pretty much in agreement on that whole thing, and that's why I thought this was, the amendment, I think, really moves it in the right direction, and appreciate your working with all the parties on this to try to get it down to something that's acceptable, because I do think it's important, and for me, it is kind of one of those exceptions where I'm sort of willing to go there too, just like you, where we usually don't like to tell professionals what they should be learning, and that kind of mandating from the legislature is not something we should do unless there's a real important need, which I think there is here. Thanks.
Any further discussion to the A3 amendment? Seeing none, all those in favor of the adoption of the A3 amendment signify by saying aye. Aye. All opposed, no. The motion prevails, and the amendment, A3 amendment, is adopted. Further discussion to House File 3023 as amended. Final word. Representative Dean.
Just thank members for the support, and we'll see each other again this evening, and hopefully everyone has time to get dinner.
I'm going to re-refer this, and a correction. I'll renew the motion to re-refer House File 3023 to go to Ways and Means as amended. All those in favor signify by saying aye. Aye. All opposed, no. Motion prevails. You're on your way to Ways and Means.
Thank you.
Nailed it. I think Rep. Helvington that we talked about yesterday.
Members, with that, we are in recess. To the call of the chair, I anticipate that we will reconvene around 7 p.m. in room 200, where we'll take up the two Fenton bills. We are in recess.